Assalamualaikum doctors. In this video I am discussing how can we take the GBS history, Guillain-Barre syndrome. So we know that Guillain-Barre syndrome there is weakness, neuropathy presence. Campylobacter jejuni is the organism responsible. Okay. So how the chief complaints can become? It can be the main complaints can be unable to walk, difficult or unable to walk, poo problem like there is blood in the urine or history of any taken recent vaccine. Recent vaccine exacerbate or trigger GBS. So how can we take as usual first chief complaints analysis, onset course and durations, what make it better and what make it worse. Is it preceded by any illness? Is it unilateral or bilateral? So difficulty in walking always ask about unilateral or bilateral. Is it the first time or recurrent occur, especially if asystemical migraine and moya? Is it upper limb affected or not? Okay. Do you feel his legs stiff or floppy? Is his foot is dropped? Can he feel pins and needle? Any diurnal variations? Any swallowing problems? Any jaw stiffness? Ask about the motor level. Can he crawl? Can he sit? Ask about the sensory level. If I touched his little finger, can he feel? Then we will go up till we reach the level. Again, chief complaints analysis I am telling. First of all, onset, course and durations. What make it worse and what make it better? Is it preceded by any illness? Okay, is it unilateral or bilateral? Is it the first time or recurrent, especially if asystemical migraine and moya? Then is the upper limb affected or not? Do you feel his legs stiff or floppy? Is his foot is dropped? Can he feel pins and needles? Any diurnal variations? Any swallowing problems? Any jaw stiffness? Ask about the motor level. Can he crawl? Can he sit? Ask about the sensory level. If I touch his little finger, can he feel? Then we will go up till we reach the level. General, like, does he look like you and his daddy? Does he have any chronic illness, any other concerns? Then FWASL, that is fever, weight, activity and sleep. Systemic review one by one, we are going from CNS, sign of increased intracranial pressure, abnormal movements, facial asymmetry, fears, eye deviations, abnormal behavior, any concern regarding his visions, hearing or speech, any change in his head size, bugs in the brain or shunt. So as usual, all the routine questions, GIT, tummy pain, tummy size, poo nature, if he had loose motions before, ask about poo control. Remember poo nature, any loose motions before, this is very important. Asking then serious awareness of the heartbeats, chest pain, how many pillows, anybody, edema, eyelids and lower limb and tummy. Chest about any chest pain, breathing problems, cough or cold, barks and snoring sound. Urinary about the pee control, pee color, amount, painful peeing, blood pressure measured. MSK skin spots described, skin discolorations, joint pain, joint swelling, bone aches, any body lumps, hair or nail changes, endocrine blood glucose level, hematology, pallor, bleeding and recurrent bugs. Then past history as usual, 5T IOA, any trauma, traveling, blood transfusion, surgery. Very important to ask about any trauma, leg, head, leg, back, neck, recent travel and contact to COVID patient. Perinatal history, any event in pregnancy, jelly scan result, newborn screening and ICU admissions, puberty started, menses, is it regular, boyfriend, OCP, protections. Vaccination is very important, is his vaccination is up to date, polio, any recent vaccines, parents received COVID vaccines, then allergy, nutrition on a special diet, type of food, amount and growth chart. Development is important if the child less than 2 years in details and growth chart. Family, similar conditions, sudden death in the family, social, school, psychological and impact. So this is GBS history. Like it can come like a history of swinging gait after dysentery. By 1 month child feel back pain and I mentioned ataxia, DD, GBS. All discussion was about GBS. A vague scenario, most went with ataxia only. So remember that is 1 month before there is any loose motion something and child is difficult walking. The differential diagnosis, first of all, Guillain-Barre syndrome, GBS. We can keep acute flaccid paralysis, infection like polio ascending, diphtheria and botulism descending manner, post-infectious autoimmune like GBS, transverse myelitis, sensory level due to infection and trigger, and autoimmune diminution of nerves, trauma, tumor, and acute cerebellar ataxia. So remember what are the our DD, GBS, acute flaccid paralysis, transverse myelitis, trauma, tumor like spinal tumor. It can be post-viral cerebralitis. These are the DD we keep. Thank you.